The No-Bite 5 is an insertion accessory for oral and nasal medical devices. It's a multi-purpose accessory with 5 main functions that improve the safety and efficiency of frequently used medical devices, such as oral swabs, Yankauer suction, nasal or oral gastric tubes, feeding tubes, and nasotracheal and oral tracheal suction catheters. Hello, my name is Nicholas Pastron, and I'm the inventor of the No-Bite 5. I've worked the past 7 years as a registered nurse in various areas of critical care, and I'm reminded daily of the need for this device. In a hospital setting, most patients, whether young or old, have difficulty when oral or nasal devices are being inserted. Patients tend to bite down on instruments and exhibit uncooperative behavior when critically ill, confused, or even under the effects of certain medications. To better understand the No-Bite 5, we will now show you the 5 functions with 3D animations. The first 2 functions will be explained together since they are so similar. Number 1, oral cleaning, and number 2, oral suctioning. Oral cleaning and oral suctioning are common everyday tasks that are done every 1 to 4 hours on critically ill patients with breathing tubes or patients that require total care. Oral cleaning and oral suctioning should be easy, but when the patient is uncooperative, it can be very difficult and unsafe to both the caregiver and the patient. For oral cleaning, most hospitals use green swabs to clean and moisten a patient's mouth. But when the patient bites down on the green swab, the patient stops the cleaning process. The swab can break, or the green sponge can even be bitten off inside the patient's mouth. Also, if a caregiver attempts to retrieve that broken off piece, the caregiver is at risk for getting their finger bitten. As for oral suctioning, most hospitals use clear hard plastic tubes to suction out saliva, usually called Yankauer suctions. But when a patient bites down on the Yankauer suction, the patient prevents the caregiver from suctioning and can break off a piece of hard plastic inside the patient's mouth and cause injury to the patient. Again, if the caregiver attempts to retrieve that broken off piece, the caregiver is at risk for getting their finger bitten. So if a patient is known to be uncooperative, and oral cleaning and oral suctioning is necessary, insert the No-Bite 5 into the mouth. Turn on the light for better visualization and begin oral cleaning and oral suctioning. The patient's mouth will be maintained in an open position, therefore preventing the patient from biting down on oral cleaning or oral suctioning instruments. Number 3, tracheal suctioning. The tracheal suction catheters are commonly used every 1 to 4 hours on patients with respiratory distress, critical illness, moderate to severe weakness, and paralysis. The tracheal suction catheter is a soft, pliable plastic tube used to suction out secretions when the patient is too weak to cough up secretions on their own. The first method of tracheal suctioning is nasotracheal suctioning. The suction catheter is inserted into the nares and continues down the trachea to suction unwanted secretions out. This insertion method could cause trauma and bleeding to the nasal area, and the suction catheter also has a tendency to coil in the back of the throat. The second method of tracheal suctioning is oral tracheal suctioning. The suction catheter is inserted in the mouth and continues down the trachea to suction out unwanted secretions. Usually, this method is attempted if coiling continues to occur during the nasotracheal approach. Also, the oral tracheal method is used on patients with increased coagulation times, nasal fractures, or deviated septums. Using this insertion method, the patient can easily bite down on suction catheter and stop the suctioning process. The patient can bite off a piece of the suction catheter, and also the suction catheter has a tendency to coil in the back of the throat. With the use of the No-Bite 5 and its tracheal suction catheter guide, tracheal suctioning becomes quick and easy. Have your supplies ready and simply place the No-Bite 5 into the patient's mouth. Turn on the light for better visualization. Insert the tracheal suction catheter into the guide until desired depth of the trachea is reached, and then suction out the trachea. This method prevents the patient from biting down on the suction catheter, and the tracheal suction catheter guide prevents coiling of the suction catheter. Number 4, nasogastric tube, and number 5, oral gastric tube. The fourth and fifth functions will be explained together since they are very similar. NG tubes and OG tubes are commonly required in hospitals before major surgeries, stomach decompression, various stomach and bowel issues, and also for tube feedings. NG tubes and OG tubes are made of pliable soft plastic that is either inserted in the mouth or nose, then down the throat, and then into the stomach. Sometimes the nasogastric tube can coil in the back of the throat upon insertion and cause a very unpleasant and painful experience, especially when multiple attempts continue to coil. But with the use of the No-Bite 5, this is an easy problem to fix. Simply insert the No-Bite 5, turn on the light for better visualization, and start to pull out the coiled NG tube until you can see the tip in the back of the throat. Now begin to reinsert the NG tube, but use the curved edge groove as a guide for the NG tube to prevent coiling of the tube. As for OG tubes, insertion can be difficult when the patient is uncooperative and biting down on the OG tube. The patient can stop the process of OG tube insertion, damage the OG tube, or even cause injury to himself or the caregiver. So simply place the No-Bite 5 into the patient's mouth to maintain their mouth in an open position. Turn on the light for better visualization and insert the OG tube. As you can see, the No-Bite 5 has revolutionized the way we use oral and nasal medical devices. Doctors and nurses across the globe can now decrease the risk of injury to patient and caregivers, decrease stress and pain levels on patients, and also save time on previously tedious and lengthy tasks. The No-Bite 5, improving safety and efficiency in oral and nasal medical devices.